put into place to prevent anti-dumping?
Is it called?
Oh, sorry.
I can vouch that Jake does have terrible handwriting.
Okay, EMTALA. So 60 years ago, what would happen is that paramedics would show up.
Hey, now.
And no,
Easy.
Be careful.
and two of them would show up, and they would show up in a hearse. And then they would put the patient in the back of the ambulance, and then they would both get up front. True story.
God, I wish.
And then they would try to drive to a hospital. Well, hospitals got hit. Like, no, I don't want Jamie Robinson. She don't have no insurance. And so then what would happen is the paramedics were driving around and they didn't have anywhere to put their patients. The other thing that would happen is that we would have patients show up to SETI and they would be like, you know what, you look like you need to go to downtown Truman. And they'd put you in the wagon and sip you on down, and then Truman would be like, whoa, I wasn't ready for that patient. And so in the world, the government put a law into place saying that every patient deserves a medical screening exam prior to any type of payment. Now, registration, you get your name, your date of birth, your insurance card, but really, you can't take any type of payment prior to your medical screening exam. And remember, we have two ERs here. We have the main ER and we have OB-ER. How many yards is the perimeter of the hospital regarding EMTALA?
Is it 200? 250. That's ridiculous. 251.
Hold them up for Katie.
What did you write out? Okay.
250. So it's 250 yards, the perimeter of the hospital. But now if you think about it, this is a really big campus. So I'm not asking you to go to the middle school and pick up somebody off the playground. And I'm not asking you to go over to the church and pick somebody up out of the parking lot. That's private property. EMS will show up, they'll do their thing, they'll bring their patient through. If you find a patient in the parking lot, please don't step over them.
On your way to your.
Previous people. But really, you need to stop, assess the situation, and you can call a rapid response, and a whole slew of people will come and help. Now, there's two categories there, like women's health, right, the clinic over there. Express care, same thing. They got two options. Mommies come in and they're like, I think I'm in labor. And then it's like, you is in labor, okay? You got two options. Put them in a wheelchair, wheel them across, get them to the right ER. Right ER? And then,
Not
or
our ER.
No.
if they think that they aren't gonna make it, they can call JCAD. JCAD will put them in the back of their ambulance and bring them up around. Fair? So there's a lot of conversation out there. You can go to the parking lot for a rapid response. Okay, please do. But the bigger kicker is please don't say, you know what, you're at the wrong entrance. Go ahead and get in the back of your car and drive up around the hill because the ER is on the other side. Because what can happen is they'll leave, they'll go off property, and then some other hospital will be like, that's an EMTALA violation because they didn't treat you. And then we have no way to prove it. Name 3 signs and symptoms of a stroke.
I got
It's like, are you collaborating over there, Natasha?
Yes. Oh, I'm
Yep.
sorry, here you go. Thanks, that was our answer.
Facial droop, slurred speech, weakness, dizziness, blurred vision. Here's the kicker. Dizziness is a little bit getting missed. And if your patient starts to have dizziness, you really need to work them up for a stroke. In the stagnant society that we have right now, clotting is a real serious issue. And so even in the OB world, more specifically, they're doing a lot more testing on those pregnant moms because the clotting is way bigger, along with having strokes and symptoms. Your patient starts to have slurred speech and left-sided facial droop. What is your next action?
Oh, and then.
Yes.
And then CT.
Call a code stroke.
Overachiever.
I wasn't sure which one you were gonna pick.
When the surveyor came, she said, said, how do you, your patients always have signs of stroke, what do you do? An individual said, we call a rapid response, and she said, why? Good point. Everybody in the hospital has to have stroke education, therefore, everybody is knowledgeable enough to call a code stroke, and calling a code stroke clears a CAT scan faster and helps our patients sooner. How do you call a code stroke?
In case you didn't.
No.
Yes. Call a code stroke. *8. Now here's the deal. Pretty please. Wait for the tone to stop before you talk. There have been times where individuals have not, and then therefore nobody knows what we're doing or where we're going. For example, a 4 ICU nurse called code security, but I couldn't tell where she was, and then all of a sudden the phone hung up and I heard an ah! And I was like, whoa, where do we go? Okay? Pretty please. Let the tone beat first. On the new phone system that we have, we are absolutely going to be able to have that capability. What isolation precautions should be used for COVID positive patients that are not utilizing aerosolizing procedures?
Because they just changed it.
Non-aerosolizing.
They only gone down.
Don't overthink it.
Okay, droplet.
The
The COVID clovers are going away,
That's it.
and we're just going back to our standardized infection control procedures. Contact, droplet, airborne, enteric, right, procedure. And so don't overthink it. Now, here's my caveat. If you have a COVID positive patient, please get yourself a good set of goggles. There's a set on Amazon, they're called Uvex, they're like $15. They have little bits on the top so they don't fog over, and then when you slide them on your head, they don't fall off. And they're super nice. There's a very big, nasty respiratory bug going around, right here? And we don't know what it is. So protect yourself. What mask should be worn if your COVID positive patient is utilizing an aerosolizing breathing treatment?
Oh God, I can't remember what it's called. This one and the big one.
N95, you're very correct. So if
The
your
halo.
patient is COVID positive and is not on a breathing treatment, your level 3 mask, your goggles, your gown, your gloves are good to go. If it is an aerosolizing procedure, breathing treatment, CPAP, BiPAP, ventilator, those types of procedures, then you do need to wear your N95. Name 3 different tactics for de-escalating a patient. She's right.
Okay, but I don't see where anybody put ketamine as an
I
option.
I was about to say that. I was like, just look at him.
When we are talking about de-escalating, we are not referring to the patient that's having acute psychosis and banging their head up against the wall because of either substance abuse or a mental break. We are talking about an angry individual that we need to calm down. Many times that occurs in the waiting room. And if you can get them out of the waiting room into a private room by themselves, that's about 80% of it. Because it's a show. The second piece of that is if you can get them to sit down, that's a bigger piece of it too. There's evidence that shows that your body just relaxes once you sit. Along with, I need you to remember You're the adult. Coping mechanisms of society is at a -12. Okay? 2 years ago, it used to be at a -2. In March of 2020, when we shut down, people lost their jobs, people lost their insurance, and they were scared to leave their house and to especially come to the hospital. What we are seeing now are the after effects from that shutdown. So therefore, you have to remember, you're the adult. Somebody can scream at me all they want. It's not gonna hurt me. That being said, you keep yourself safe and you stay next to the door. What is the name of the class that is utilized at WMC to teach de-escalation?
What happened? I'm gonna sign you up
I know
for that.
security. Starts with a C.
CSR,
CSD,
CRS.
something.
Too many acronyms in nursing. We broke them.
Doug yelled at me for not taking it. Can I call it that?
Then you should remember if Doug yelled at you. That's like the nicest person ever.
Well, he Doug yelled. He was like, "Hey, you gonna take this?" And I'm like, "I'm sorry."
Hold up your board for Katie, cause
Doug
this is
yelled
pretty
at you.
awesome. Right here, skills orientation. I like it.
Okay.
Yeah, that is effective. Right there.
What are you teaching them in orientation?
How to de-escalate.
Maybe there was a C in there.
CPI. Now, for those of you that have not known the answer, therefore you need to take said class. It is actually in HealthStream. If you click on event calendar, it's called CPI. Doug does a very nice job with it. And it'll last about 4 to 6 hours depending upon how big the group is.
He keeps offering to do it in the ER because I'm always working when he does it.
Yeah.
So I
He keeps
just
coming to pain and telling us, you girls need to come in on a Friday.
Yeah. It's a good class.
That's the other thing is that he is also willing, and Kim Lockard, his manager, are very willing to do some side classes as well. But you guys, okay, all of you are in high risk areas, and so we need you to really take this class. How long does it take to de-escalate?
You apologize. It takes like 2 minutes. Until you dove them.
Indefinite.
Never.
Some people.
First initial J.
Okay, the answer is as long as it takes. You can yell at me all you want, you're not gonna hurt me. And you have to look at the whole situation. I had a little old lady, she's demented, and she looked me square in the eye and said, "Did you summon the demons like I told you to?" Yes, I did. Like, it's fine. A lot of times, I have to really watch. Psych patients don't like my red hair. It is a trigger for them. And so if and when I was called, I used to be an ear doctor, so they would come and get me, like, this person's not happy. And I would go, and I would put on a white coat for no purpose, and it was white. It said nurse leader on it. And I would pull my hair back, and my blonde covers my red hair. And then I sat on the wheelie chair inside the doorway, and we talked. They could stand up, they could stomp their fist on the bed, they could, it's okay, let it out. And then we were able to get to the next situation. Name 2 SIRS criteria.
Increased temperature. Lactic acid.
So tachycardia, tachypnea, fever, hypothermia, out of whack white blood count, an elevated blood glucose greater than 150. What lab must be drawn prior to antibiotics being given in a sepsis patient?
Not like the top says.
It can.
Okay.
So, cultures. Here's the deal. If you are giving antibiotics to your patient, you need to stop and ensure that the cultures are drawn. Here's the deal. Broad spectrum antibiotics are really great, but they kill everything. And you would rather have the cultures drawn so the bug can grow out so we can later, in the ICU, figure out which bug that is and hone in on the antibiotic. Because if not, all we're doing is making big ugly super bugs. 10, 15 years ago, when sepsis first came out, there was an ER and we looked at everybody's data and I said, well, they're all green, what are they doing? They were given Cipro with triage to everybody, PO, just because. Because if you have antibiotics prior to arrival, you fall out and you don't count in the numbers. It's not the right thing to do. What is the name of our contractor partner for transplant services?
Presley. Right.
Yes. Midwest Transplant. Super, super nice people. Super great in regards to assisting with family and patients and medical staff. If your patient expires, in what time frame must you call Midwest Transplant?
I don't know, I think it's
So guess, I don't.
yeah.
Oh.
60 minutes.
One,
That's what I thought.
two.
Who calls MTN?
I think,
Mhm.
yeah.
PCS. So therefore, the role of the story is that if your patient expires, PCS must know about it quickly. Okay?
I just hired my name built over.
Right.
And that is the end of trivia. How did we do, Katie?
These are
You
my
did
words.
good. Or if they're going to expire and you need to make a reservation, then you call PCS. And then we can cancel the reservation if they